Hello, I'm Dr. Naranjo from Elite Laser Clinic in Madrid, Spain. I had the chance during the last 15 years to test many different devices in my clinic, but also to do plenty of clinical studies at the university. We had the chance to test more than 350 different technologies, lasers, IPL, radiofrequency, ultrasound, pressure therapy, in each patient, in each protocol, trying to find the best result to our patients. When we talk about local adipose tissue, we need to look about what we want to obtain in our patient. A long-lasting result or a short-time result. We can break the cell or we can take out the fat from the cell. The question will be, which kind of treatments enable us to break the cell? We need to look to the Food and Drug Administration. The FDA in USA determined that there are 3 technologies who are able to do it. First one, injections of lipolytic solutions. Problems, they are not legal in many countries like in Spain. Second, cryolipolysis, extremely interesting technology, but also limited by the way it works. So it's quite complicated to select properly the patient. You cannot have less than 2 centimeters of fat. We cannot apply if we have an excess of laxity because we have too much laxity and the handpiece takes this skin instead of the fat inside. So it's too dependent on the condition of the patient. So I want to have something who break the cells, who have a long-lasting result, who is non-dependent on the patient, who is extremely safe and extremely quick. And for that, FDA offers us only one possibility, the ultrasound in kilohertz. So Alma came with this technology, this amazing, powerful ultrasound in kilohertz, offering us the possibility to work with thermal or with mechanical effect. We are talking about mechanical like a way to break the cells. And the problem can be that you solve the accumulation of fat, but you generate excess of laxity. And this is a huge problem. So how to solve that? The synergy of ultrasound in kilohertz and radiofrequency, unipolar, with a dielectric effect with the 40.68 MHz, really offer us the possibility to achieve everything in one treatment. This radiofrequency with this specific frequency doesn't work like the other ones. Regular radiofrequency works with overheating, and this overheat creates compactation of the tissue. So to have good results, you need to have a lot of fibrotic tissue. If the patient doesn't have a lot of fibrotic tissue in the subcutaneous layer, radiofrequency is not able to compact. So when we talk about dielectric heating done by this device with 40.68 MHz, we talk about molecular rotation. This dielectric effect means the rotation of the molecule of water is going to create the heat. So with this patent of the unipolar technology, 40.68 MHz, we solve those problems. Not anymore dependent on the condition of the skin, not anymore dependent on how thick or thin is the layer of fat. Ultrasound in kilohertz in different layers, but also radiofrequency to be able to create tightening effect immediately after the ultrasound. Both techniques can be combined and should be combined in the same patient in the same session.